Dr. Flamm, welcome to the Valder Beebe Show. Welcome, Rosetta. Thank you both for joining us today.
Thank you for having us.
I'm going to start with you. Would you define what liver disease is and why women are at a higher risk of developing certain types?
Well, liver disease in general is a very common problem in the United States, and it doesn't always come from alcohol use. Many people have liver problems when they don't drink alcohol. And one disease that is an autoimmune disease, meaning your immune system attacks your liver and damages it, is called primary biliary cholangitis, or PBC. And this particular one, for some reason, seems to attack middle-aged women aged 35 to 55 more than anyone else. So that's what PBC is. And like many medical problems, and liver diseases in particular, because that's what I do, if you don't diagnose these problems early on and treat them aggressively, you have a much greater chance of needing a liver transplant or dying from the liver problem down the road. So we try to highlight liver disease around the country and make sure patients are really taken care of properly.
I'm going to switch to Rosetta for a moment and talk to Rosetta. Rosetta, you were diagnosed with PBC. How has this impacted your life?
In 2017, when I was pregnant with my youngest son, I went to put my contacts in one morning and my eyes were actually yellow. So it was really scary. I started developing all these troubling symptoms, yellow skin, itch, fatigue. My doctors initially thought that it was related to the pregnancy, but I didn't get any better. So eventually I was sent to a liver specialist where I had a blood test and a liver biopsy that diagnosed me with PBC. It was really frightening.
Dr. Flamm, is Rosetta in that age group that this disease becomes prevalent?
Yes, it is. Yes, she is actually. She's in that age group. And fortunately, we do have medical therapies for patients like Rosetta, and that's why I think Rosetta is doing much better now than she was previously when she was diagnosed. And, you know, about 25 years ago, Valder, a medicine called ursodeoxycholic acid, which is a natural substance. It's in all of our bodies already. It was approved in high doses for treatment of PBC. And while it doesn't cure PBC, it slows the disease progression down, which is very important. The problem is it works optimally in about 60% of people, but 40% don't have an optimal response. And one of the advances in the field, Valder, has been the addition of second-line therapies to the regimen for these people that the first-line therapy isn't working perfectly in. One of those medicines is called Iqirvo that got approved last year. Now, Ipsen makes Iqirvo, the company, and they're compensating Rosetta and myself for our time today. But this medicine in patients like Rosetta helped 51% in 1 year have a much better treatment response than they were having already with only their first-line therapy. The medicine, fortunately, is well tolerated. Some people had muscle aches, and there were a few liver problems reported, actually, and bone fractures have been reported. But in my experience, it's extremely well tolerated. So I guess the bottom line is for PBC, if one of your listeners is eligible for this therapy, they need to have a discussion with their doctor, like with any new medicine, about the risks and benefits of taking it and see if it's appropriate for them.
Dr. Flamm, I'm sorry, I would love to talk with you because you seem so well-versed on the subject, but I know your time is limited. I want to thank you and Rosetta for bringing this out and talking about this. And Rosetta, I'm so glad you're here to share this with my audience. Thank you both for being my guest on the Valder Beebe Show. I appreciate it.
Thank you.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to youtube.com/ValderBB Show and stay connected as I interview the world's most fascinating people.